GLP-1 medications are everywhere right now. They're on the news, on the social media, and at your neighbor's dinner parties. But what should an endocrinologist actually look at before prescribing the medication? And what does a successful long-term outlook look like? That's what we're going to look at today. So when we talk about GLP-1s, we first got to talk about the diagnosis that we're going to use to treat people with these weight loss medications. And the diagnosis deals with using a measure called the BMI. The BMI is a measurement that looks at height and weight and has been defined to look at what is a diagnosis of obesity, and so that it would be a BMI greater than 30. The BMI could be also 27 or above if we have complications that are related to heart disease like equivalents, such as high blood pressure or high cholesterol or diabetes, but diabetes would qualify for a GLP-1 under the diabetes rubric. That is what is the diagnostic requirements for someone to get a GLP-1. They have to have a BMI over 30 or 27 with hypertension or high cholesterol. So the reason why it's important that we treat obesity in the first place, and the reason why we do it in patients who have risk for heart disease specifically, is because obesity is one of the very important aspects that can increase your risk of having a vascular event. A vascular event would be a heart attack, a stroke, or peripheral vascular disease. And so we consider obesity as a disease, and therefore we treat it just like other diseases, such as high cholesterol, hypertension, and diabetes. And so to do that, we're looking at prevention. How do we prevent people from progressing down the road towards heart disease or vascular disease, which is really the major issue related to all of these particular disease processes. To do that, as an endocrinologist, I am focused on that aspect of this disease process, and that's really why we treat people who are overweight. Not necessarily for their cosmetic issues, not necessarily for other things, but it does have other benefits. They do have benefits, particularly in relationship to problems like sleep apnea, arthritis, other vascular problems. And then there is a general overall well-being that goes along with losing weight. So those are the reasons we do the treatment for obesity with GLP-1s or other medications. So when we treat someone with GLP-1s, we treat them for a period of time, and that period of time is not always specific. It depends to some extent on how the patient responds to the GLP-1 and whether they have side effects and a lot of other factors. So it's, again, like any other disease process, any other medication, we fit the medication to the patient and their needs. But as many people have discussed, the difficult issue with all weight loss is about maintenance, okay? It's not just GLP-1s, although that's the current treatment that we use in a great deal, but all medications, all treatments that have been used for weight loss have been associated with the issue of weight regain when you stop the medications. In fact, there's long-standing data that shows if you take a weight loss medication, or if you have a weight loss as a result of diet, and you stop your weight loss treatment or your diet without changing your behavior in relationship to the eating behavior, the dietary the dietary aspects of that, then about 90% will go back to their original weight. So we all know that this is an issue with all weight loss kinds of medications and weight loss types of treatment. So how do we fix that? Well, we really haven't gotten very clear guidance in our literature as to what the long-term treatment are with these medications. We Many times we use them like we use other long-term medications, like a antihypertensive medicine or a lowering medicine. We just keep treating the people, and we treat them maybe with a lower dose. Maybe we'll go down to a lower dose to maintain them at that particular level. And I've also seen patients who've stopped their treatment and they've maintained their weight because they've changed their dietary habits, they've changed their exercise habits. So it's a conglomeration of things to do to try to maintain weight, but it is an issue that we're going to have to be more clear in the literature and in guidance over a period of time in order to come up with a plan for people who are on these medications at this time. So as you know, there are side effects of these medications, and about 20% of time there are mostly GI side effects. The GI side effects include nausea, some people have constipation, and some people have acid reflux or heartburn. And these are usually managed fairly well by starting at lower dosages and titrating up slowly and finding a place where people are feeling comfortable that they're having an adequate amount of hunger decrease or weight loss, but not having the abundance of side effects. Because obviously, for a chronic medication, you want to be able to tolerate that medication comfortably. And so I try to sort of, again, meet the patient where they are in relationship to their disease process and to their medication. So I go up slowly. Sometimes if they've gone past a level where they're having more side effects, bring them back down to another level. Occasionally we'll use some anti-nausea medications. My general philosophy is not to treat a side effect of a medication with another drug, but sometimes we just have to do that in certain circumstances. But I think that, for the most part, although there are some patients who have significant problems with tolerating the medication, most people are able to work through the process. So, side effects are all very personal, and people have different ways of dealing with their own side effects. Some people find them to be very disruptive, and others find them to be less so. So it really, again, depends on the individual as to what kinds of methods we would use to help them with their nausea or constipation or whatever it is. But the general rule of thumb is to, again, try to decrease the dosage to a point where they're most comfortable. Try to be, as well hydrated as possible. If the symptoms get so significant that people are having, nausea and vomiting and other symptoms on a consistent basis, then we might need to either discontinue the drug for a period of time and then go back. But it's all a matter of just trying to work with the individual and what their particular symptoms are. So, as you know, there's many different ways people are accessing the weight loss medications. As an endocrinologist, we have a special skill set associated with these medications because we've been using them in one form or another since 2006. In 2006, the first drug that was a GLP-1 called Byetta was introduced for type 2 diabetes. And then over the last 20 years, there's been more and more medications, and all of these medications were known to have some weight loss effects. But now the weight loss effects have been so significant that they are really profound in terms of improving someone's overall cardiometabolic health by decreasing their weight. So we have obviously been involved with them and are understanding how to use them, have a lot of experience with them, recognize the side effects. So endocrinologists are really the obvious expert for someone to see in relationship to weight loss, in addition to diabetes, which is the drugs are used in that form also. But I think the telehealth options are available, but I think you're getting the expertise that you would hope for when you're taking care of a medical problem like obesity with weight loss medications by seeing an endocrinologist. So if you're interested in seeing us for your weight loss, we have the ability to do that, and we can treat you with all of the medications that are available at this time in the most appropriate and comprehensive way.